So we're just gonna do a little bit of a twist. So here, go.
Wow, that feels good.
Yeah. Hi everybody, this is Emma. Today we're going to be working on Emma's hip. So she's having some pain in her right hip. She feels like it's deep, like within the actual hip capsule. She's also having a little bit of pain like on the glutes. She's a student, so you're sitting at least 4 hours a day, right?
Maybe more, yeah.
Maybe even more.
Yeah.
And so a lot of like that flexed forward position in the hip is causing a little bit of tightness. I went out and ruled out any sort of real anatomical stuff going on, like labral tear, or like actual hip pathology when you were laying face down. We did a little bit of an exam before we started filming. So I feel like really for you have a lot of tight musculature. How often are you doing Pilates? And how often are you working out? Give me a little bit of an update on your workout routine.
So I do like a mat Pilates or like hot yoga, I would say like 3 to 4 times a week. And then I try to do a reformer Pilates once a week.
Okay.
And since, well, I'm from Canada, so it's snowing.
Yes.
So I haven't really been able to do my walks as much as I'd like to.
Yeah.
But in the summer and like springtime, I'm a server at a golf course, so I'm walking like constantly on my feet.
Yeah.
So it's like walks, and I would say Pilates like 4 times a week with like hot yoga in there as well.
And I know we chatted that you feel like the Pilates has helped the hip. When you're done with Pilates, are any certain movements in Pilates that aggravate it? I know you said a little bit of external rotation.
Yeah.
Okay.
Yeah, so like anything like that, if I'm laying down on my side, if I'm doing like lifting up my leg, bringing, you know, like those types, like working on my glutes, then it'll start to like seize up, and I actually have to like get out of the movement and like kind of like work it, you know, whatever.
I hate that one where you're like,
okay. Yeah, and like to make it so that it's not seized up, because it like will cramp up.
Yeah.
And then I get out of that, and then I can go back into it.
Yeah.
But then the next day is sore.
And I know you said, where's my little model? I know you said sometimes it also feels a little bit numbness tingly. So this is a model of her hip. So if I was faced forward, I would look like this. But if I was faced backwards, we have the piriformis muscle that lines right here in our glute, and the sciatic nerve runs right through it. So when you're like, this muscle feels very tight, it's chances are, and it feels nervy because that nerve is running through there and compressing in, or the muscle is tight, compressing in on the nerve. And that might be why you're like, okay, it's feeling a little bit like it's running down the leg or the back of the leg or the side, and it's hard to kind of pinpoint the specific area of where that pain is, if that makes sense. Okay. So what we're going to first do is I'm going to have you start on your back, and I'm going to work the front part of the hip. Do you want me to do both sides?
Sure.
Okay. So when we were doing an exam on Emma, I found that, let me redo it. So if I come up here on the right side, which is the main side that's bothering her, I'm bringing her into flexion, a little bit of external rotation, and internal rotation. And this like actually feels pretty good. It's mainly flexion that is giving me restriction. But when I come over to her left hip, and I come up here, and I bring her into internal rotation, there's a little bit of a give there. So that's why we're gonna handle both hips today and see if we can give a little bit more mobility between the two. The other thing I wanna show right before we start is when you bring your leg up here, you have a little bit of tightness within this hip because ideally we want the knee to be perfectly perpendicular to the other knee. So we're gonna start there today, okay? Do you have any questions before we get started?
No.
You trust me?
Of course
I like your all brown outfit today.
Yes, thank you.
It's so cute. I actually feel like I have that same sweater.
I got it for Christmas.
Yeah, it's so cute. I don't have the pants though. I just have shorts that match.
Ooh, maybe I need to get those. Yeah, I could feel that. Like,
you could feel it?
right in the front.
Yeah. So I'm just gonna first start with this psoas, warm this up just a tad. How do you like your Aura ring?
I love my Aura ring.
I know. I've been wanting to potentially get one. I just haven't pulled the trigger. They're expensive.
They are expensive, but this was a Christmas gift, so it's something I've wanted for a while.
Yeah.
And especially like starting my holistic health like schooling and all that kind of stuff. It's nice to have those like markers. Like I wake up and I check my sleep score and my readiness, and like tells me if I'm like super stressed and I need to take it easy, and it like validates, you know, what you feel, I guess. Like sometimes you think you're going crazy, but you're not.
You're like, my ring tells me otherwise.
Yeah. But I love it.
Emma's gonna be a holistic health practitioner,
Yes.
kind of, right?
Like it's holistic health, but my certification is a certified nutritional practitioner, so a CMP.
Okay.
Yeah.
So
But
that's
it's
what you'll
holistic
call
health.
yourself, like a certified, like
a CMP.
a
Yeah.
CMP.
Yeah.
So I'm just moving down just a tad lower. Do you love what you're learning so far?
Yes, I love it.
So are you learning more nutrition-based things or supplements or a little bit of both? So you're gonna be here,
everything.
and then you're gonna bend your knee. Okay, come up, and then bend the knee.
Oh yeah.
Yep, and then come back up, and then bend the knee. So all things?
Yeah, like anywhere from like, we start with like biochem, physiology, anatomy, body metabolism, pathology, like all those things. Then we do like nutrition, and then we have like symptomatology classes, so like doing like, you know, disease and symptoms, and talking about supplements and like herbs. So I have to do like a, what's it called? Like a herb class essentially.
Yeah. Are you allowed to run blood panels?
So I can do a continuing education course with the school, which I'm planning to do after, where it's basically learning to read like blood diagnostic tests and stuff. I'm not sure with that class if I can actually order them or if I'm just taught how to read them if they came to me. Like they might have to go to like a naturopath or whatever, and I could work with either a medical doctor or a naturopath to get those tests done, but then I'm able to read them. So yeah.
That's exciting.
Yeah.
The blood work stuff is a whole other ballgame.
Yeah.
I remember we had to learn that in chiropractic school too, like how to know what to take, how to know how to read them, and all of that. And it's definitely not, you know, an easy.
But it's important though.
It's so important.
A lot of people like appreciate like that knowledge, you having that knowledge, right?
Absolutely. What also helps every once in a while, someone will bring in their blood work, and it's like important for me to understand a bigger picture of their overall health. Or sometimes when things aren't adding up physically, I'm like, I think you should go get some blood work, because I think there might be something a little bit more systemic going on.
No, for sure.
How does this side feel compared to the right?
I feel like it, like there's more, like I'm feeling more pain when you do that. Which is odd, because I thought it was like, here's the problem, but I guess everything's like
shifted a little bit. And tell me a little bit about your family history. So I know your mom has a little bit of hip problems.
Yeah, my mom has arthritis.
Okay.
Her dad had hip replacement because he had arthritis, and he also suffers, well, this is an ongoing like case. I feel like that's still open for him. Like he suffers a lot from nerve pain, like lower back, like lumbar region. And they can't really figure it out, like what's going on, because they thought it was like, you know, first it was the hip, then he got the hip replacement, and then he fell after that, and then that's when this nerve pain started to happen. And then my mom's mom also suffers from like some sciatic pain and stuff like that. So it's kind of a common theme in my family, unfortunately. But that's like why I'm really passionate and like coming to get this work done, because I don't want to have to end up in pain like that.
Absolutely. Then come back up.
Yeah, because I see like my grandfather's quality of life, and it's like, you know, he's in pain all the time, and I don't want that for me. So
I also think family history gives you a good picture of what can go on. And can give you kind of like a foreshadowing of the way that your body potentially can react. And I think if you know that your mom has hip arthritis and certain hip pathology of something going on, it can be even more important for you to have a good sense of what's going on within your body, so then you have the ability to prevent that from happening with you. Let's have you go onto your left side, so you're going to face the cubbies for me. If that makes sense. So you kind of already know what's going on with her. So you can make sure we try to do things to prevent it. Take this bottom leg and you're going to bend it. Yeah, perfect. Just to kind of give you a little bit more stability. So I'm going to come in first, and we're going to work on the front part of the hip.
Okay.
So you're going to bring your knee into your chest, and then you're going to bring your leg back towards me. Okay?
Yeah.
So come forward first. Okay? And then reach back.
Yeah. Oh.
Yeah. And then come forward. And then reach back. Yeah, and come forward, and then reach back. Good, and then come forward, and then reach back. So you see first thing is you don't have too much hip extension.
Yeah.
I'm gonna come and we're gonna do psoas. So same motion. I'm just gonna be in a different spot. Go ahead. Good. Forward. Good job. One more here. Good. And is it painful or is it tight?
Like at first it was painful, like right in here. And then as I kept doing it, it almost like felt a little bit better. Like it wasn't as painful, but.
You're gonna take this leg straight and you're gonna bring it forward and drop it down.
Okay.
Through that crack. Okay, go ahead. You're gonna hold at the bend. I know. Come back. So this is glute max.
Like I can almost feel it wanting to lock too when I go this way.
You let me know if it's too much or if you feel like we're gonna have a spasm. Good. Okay, relax down. Okay, then we're gonna do leg straight, leg bent, and then twist. Okay. So that external rotation that you don't love. Go ahead. Yep. The face says it all. Twist. Out. Twist. Good job. One more. Twist. Beautiful. Okay. Relax. I want to do one more. So this one's going to be up, and then you're going to drop it back down towards me.
Okay.
So up, and then drop it back. Yep. Up. Drop it back and hold down there. Good. Come back up. Drop it down. Hold down there. Good. Come back up. And then drop it down. Hold. 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 Relax. Good job. She's like, you're torturing me slightly. I'm sweating a little bit. Don't worry. I'm not doing anything that's not necessary. I'm going to adjust this side, okay?
Okay.
So you can stay exactly where you are. Bring your arms a little bit more close. Put this leg straight. And then here. And then when you're home in Canada, do you see a chiropractor?
I don't.
Okay.
And you told me to last year and I didn't listen to you.
I didn't listen to you. So we're just going to do a little bit of a twist. So here. Good. Flip to your other side. You're so funny. I didn't listen and I'm back. And I'm back to see you and I'll just trust you.
Well, I wish I had you all the time, but that's not a possibility.
Bend this bottom leg so you have some stability. Perfect. So even this side though, it feels better in here to me based off of palpation. But let's do a little bit. So let's do knee to chest. Then you're gonna bring it back towards me. So do you feel the difference on this side? How you have a little bit more extension where you can actually bring this hip back a little bit more. Good. Come forward and then back. Good. And then forward and then back. Perfect. And then forward and then back. Good. And then forward and then back. Good. And one more forward and then back. Beautiful. Okay. Relax.
Like right there.
Yeah. Straight. Twist. Okay. Go ahead. Yeah. Twist. I'm like, hold. Twist up. Hold. Good. Come back. Twist. More flexion. Yeah, perfect. Hold. Good. Okay. Relax. I like these focus.
Thanks, they're my sisters.
Are they?
Yeah.
Does she know you took them?
Yeah, she's like, you can take them. I'm like, okay, thanks.
She's a good sister. I want to do a little bit in here. So you're going to do same leg movement, knee to chest, but you're going to twist this towards me a little bit more. So I'm going to be underneath your pants. I'm just going to be on the iliolumbar ligament. Okay. Okay, twist. Put your left hand on my elbow. Good. Extend. Twist. Good. Extend. Twist. Good. Okay. Stay there for me. I'm going to come around. Yeah. So do you prefer bottom leg long mat Pilates or reformer Pilates?
I like my mat Pilates
Yeah.
because I feel like it makes me work like my actual, like my own body strength more. I feel like with the reformer, I feel like the resistance and stuff is almost like you have more help.
Yeah.
Maybe. So I'm gonna do a little push here. It's a little twist.
Good. Let's do on your stomach.
But yeah, I feel stronger like ever since I started doing it.
Pilates, yeah. Well, really is getting into all of those small twitch fibers. And I'm gonna put this bolster underneath here, which is obviously different than when you're doing, you know, weight training or hitting the larger muscles.
Yeah. I just find it more enjoyable.
Absolutely.
Because like going to the gym and lifting weights, I feel like it's just so much work.
Have you done weight training before?
Yes, like I used to last summer.
Okay.
I was going to a personal trainer that I knew at the gym, and like he was great, it was good, but I just feel like for my body, like I don't know, I'm not looking to be like huge muscular, like all this stuff, right? Like I just want to be toned and fit, and I enjoy the Pilates and I enjoy the community that comes with it. So I don't know, I'm more inclined to like go do that and like stay with it than me having to go to the gym on my own and like think of my own workout routine and all that kind of stuff. So
yeah. No, I don't blame you. Because Pilates with the classes gives you that community. Yeah. Which is really nice. And weight training is hard work. It's not easy.
No.
It really isn't. Not that Pilates is easy either. No?
No, it's not, but you like work up to things, right?
Absolutely. So here I would say like both of your heels are going to your glutes, okay? But when I actually look at the difference in your leg length, like this leg is longer than this leg.
Okay.
So I'm gonna do a little bit of a drop table adjustment, okay? So I'm just gonna pop this up. I'm gonna do a little bit of a push on this right hip right in here, okay? So just bear with me. I'm gonna do 2 more. And then 1 more. Okay, that's better. Okay, let me do a little adjustment in your mid-back right in here, okay? Take a deep breath in here for me. And then blow it all the way up. A little push. Good. Ooh, that was a lot. That's all the steady cracks.
Yeah.
Okay. So I'm going to put a little bit of cups on the low back and into the glutes, okay? I'm just gonna lift your top up there. I'm gonna lift your pants down right in here, okay? And we've done cups on you before.
Yeah.
And no issues within the actual low back.
No.
I'm gonna scooch this down just a little bit more so I can get actually on the glute. I'm gonna put some cups right in there, okay? Do you like the cups?
Yeah, I need to like do them more often. I haven't gotten it done since you did it for me.
Yeah.
But my friends like love them, and my boyfriend loves doing it too. So
Yeah.
I need to.
Does he have some?
So my best friend's boyfriend has some, and they're best friends. So they kind of like
do it on each other.
Yeah.
Yeah. Well, if you understand the anatomy, you can understand where to put them. But yeah, you should have Drew put them on you.
I should just get some.
Yeah. It'd be kind of hard for you to put them on yourself with like your actual glute area, but I can always tell you where to put them.
And I feel like I should do it to my mom.
I know. It would benefit her tremendously. Perfect. So I'm just gonna leave those cups on there for a second. How about your sister? Does she have issues with her hips too?
I don't think as bad as me. But I don't know. I feel like that's something I would have to ask her, but
Yeah, I'm curious.
like I don't think it's nearly as bad as
Yeah.
like ours. But
So you can see, and you can't see Emma, but we can see that this right side is so much redder than the left.
I could feel it, like
Yeah.
the pressure.
So obviously I didn't put any on your left glute, but even here within like your low back muscles, it's so much redder than the left side. I'm just gonna do a little bit of spray to take off that lotion, so you don't go home all oily. Okay, I want you to now flip onto your back for me.
Okay.
Let's do a little bit of work on your neck. How's your neck been with all the studying you're doing?
It gets sore.
Okay.
For sure. Like this side more.
Yeah.
I feel like. And I'm like my mom tells me I'm a horrible sleeper. Like she will come in my room and I'm like contorted like sideways, whatever. Like I don't know. I'm a weird sleeper and I don't think it's great for my neck either because like sometimes more often than not I wake up thinking, wow, I slept on my neck wrong, which I feel like is not normal.
Like you have a kinked neck.
Yeah.
Yeah. No, it's not normal. We can't have that.
No.
So
Yeah,
this
like
is the
right
side?
there.
Yeah.
Yeah.
I mean, I feel that right away. Yeah, it's not, So do you favor sleeping like on your stomach?
I sleep on my, like, I don't sleep on my stomach ever.
Okay.
I'm either sleeping on my right side or I'm sleeping on my back, but I'm like legs sprawled up like this, arms out, like contorted sideways almost, so.
Yeah, see right in there. And then what about your position when you're studying? So do you do the same thing where you have like your hip kind of tucked in?
Yeah, like you're gonna get mad at me for sitting like this, but
That's okay.
I
won't get mad at you, I promise.
Like I sit with my feet up usually, like up against the table, like I'll literally be like a little baby.
Yeah.
And then more times than not, I'm like literally hunched over my laptop without realizing. And my mom's like, you cannot sit like that. Like she could just tell when she walks past me, I'm literally curled up in a ball.
Yeah.
But it feels so like normal and comfortable to me. And I need to get better at like sitting with my feet planted and like, you know, maybe getting like something for the chair that like forces me to like sit with my back straight and not crouched forward. But
so my best piece of advice is obviously to not sit like that, but that's a hard thing to do when you're it's so ingrained in like your body. So the best piece of advice I can give you is to try to do the opposite. So when you get done schoolwork, to actually get on the ground, and I know you do yoga, so when you go to yoga, focus on the extension moves that you're doing. Yeah. So upward facing dog, like wheel, like all of those ones where you're in almost like a back bend, rather than like a forward fold type position. Yeah. Because then you're essentially stretching out the muscles that you just shortened the rest of the day. Yeah. I know yoga is like a hit or miss based on what classes you're going to because some of them are very forward bending, flexion forward. But if you can, as much as you can, try to do extension based stuff. Yeah. The yoga that you go to, do they do the same thing every class? Or
no,
is it
it's something different. That's why I love going where I do. And like, it depends on like when you're going. Like I try to go to the same lady, like for example, Tuesday nights, but then there's also other teachers. So I like am rotating between like 3 different types of classes within 1 week. So I feel like it's...
You're getting a good variety.
Yeah.
Yeah.
And like, I also feel like I need to get better at like when I'm doing things like core work and abs and whatever, I'm really bad at using my neck like all the time. The teacher's like, Emma, you're using your neck. I'm like, sorry. But it's just hard because like I think it's a lot of like mind body connection too. I need to start thinking like, okay, pull in your core, use your core, and think about it more like mindfully when I'm doing it than just like doing it without thinking sort of thing, and maybe that'll help me. But
absolutely.
Yeah.
Well, it's all about like a mind-body connection. Yeah. You okay if I adjust your neck?
Yeah.
It's not always easy to do though, a mind-body connection.
Yeah.
Okay, so I'm just gonna do a little bit of an adjustment right in here. Okay. You adjust so nicely. Right in here.
Wow. That feels good.
Yeah. Perfect. Emma loves being adjusted. But she only trusts me. That's why she comes all the way from Canada just to get her adjustments in.
If I could, I would literally come here every month too.
Okay, I want you. So one thing I want you to do for the actual neck, exercise wise, is to do some chin tucks. Okay. So tucking your chin like in, so essentially pushing your head into my hand, and then relax. Perfect. Yeah, and then relax, and then tuck, and then relax, and then tuck. Good, and then relax. So this is something you can do two different ways. You could do it laying face down. So like first thing you do when you wake up in the morning is like 5 to 10 chin tucks where you're activating these neck muscles. Okay. So then when you do go to type on the computer, those muscles are already warmed up. Yeah. I love that for you. Second place you could do it is in the car. So say you're driving yoga, you're driving your Pilates, you do the same thing, but you use the back of the headrest. Yeah. And you do the same thing where you're like tucking and making yourself a double chin and then relaxing and the tucking. Yeah. To strengthen these muscles so that when you go into your Pilates class or you go into your yoga class, those are already turned on so that you already have a little bit of stability within your neck. Okay. So that would be my advice for the actual neck. I'm gonna remove this. Okay. And I want you to put your legs flat, and then I want you to bring this one over and let's see how much of a difference we have in the hip. So better. Can you feel the difference? Yeah. So see how this lays a little bit more flat, and see how your shin's more parallel? Yeah. Tuck your neck up and look. This is what I'm striving for you. Okay. A parallel shin. Let's do your other side and see if we have any change here. So this one better, but still not perfect. Okay. See how it's raised a little bit here? Come sit up for me. I'm going to show you a couple exercises I want you to do for the actual hips. So in order to work on this, and I may have given you this last time I saw you, but I want you to do 90-90s. Okay. So this is a 90 position. So see how my hip or my knee is at 90 and my hip is at 90. Same thing with this one. I want you to see how you feel in this position first. I love this because this one's an external rotation, which kind of bugs you. Yeah. And this one's an internal rotation. So I'm working both hips at the same time. If you can, I want you to take this back leg, or the back foot, sorry, and lift it off of the floor. If you can't do it upright, you can lean into the front leg a little bit to give you a little bit more range, but ideally you're here and raising. What this is gonna do is it's gonna strengthen your glutes a little bit more in this position. That's your most compromised position. Yeah. Then you're gonna do the same. One hip's gonna be easier than the other, it always is. So same thing, so hip at 90, hip at 90, and then you're gonna lift up. A cramping sensation is good, but I don't want a sharp sensation or a tingling sensation. So come on the ground and see how that feels for you. Oh, did you hear that? Yeah, a little pop. Perfect. So I want this one just a little bit more like that, but that one looks perfect. Okay, come sit up upright. How do you feel in this position? Like restricted a little. Yeah. Try to lift this foot off the floor. Good. Like it's gonna lock. It literally is locking right now. So this is what I want you to practice. Okay? Yeah. This position, that locking, spasmy sensation is good. I want it to feel like that. If we can put your hip in that position, try your other side. If we could put your hip in this position and almost recreate that sensation, and then you practice this, then your hip won't lock as much.
Yeah, like this side is better, which is weird because I thought this was the problem.
Okay?
Yeah.
So practice this. Same thing with the pre-exercise. I want you to do this pre-yoga and pre-Pilates. So get on the ground, do 10 on one side, 10 on the other side, and then get on the reformer. Or do 10 on one side, 10 on the other side, and then start your yoga class. It's activating that glute so that it's turned on, so that when you're in, you know, a lunge, or you're on the reformer and you're working that actual glute, that it's pre-turned on in the range of motion that we want, so it'll prevent that hip from spasming and being painful and being overall restricted in the first place. Okay? Do you have any questions for me?
I don't.
Okay, perfect. You're all
Thank
set.
you.
You're welcome. Good to see you.
Good to see you too.
You're the best. All done. That's a wrap.